Do you know what time of day to take your different allergy medications? Believe it or not, the time of day really can make a difference in terms of your allergy symptoms. If you're new here, I'm Dr. Tania Elliott, board certified allergist and internal medicine specialist. I'm going to walk you through the top allergy medicines and the best time to take them to get maximal relief. First, let's understand the different types of allergy medications and their purposes. Antihistamines, these can be taken daily or as needed, and these are things like Allegra, Claritin, Zyrtec, and dare I say, Benadryl, which I typically don't recommend to my patients. Decongestants are used to relieve nasal congestion, so things like Sudafed. Now remember, an over-the-counter decongestant called phenylephrine was actually removed from the shelves because they've been shown to be ineffective. So that's a medication commonly known as Sudafed PE. So if you see that, walk away. It's not worth your money. It doesn't show any benefit over placebo when it comes to allergy or cold and flu symptoms. Nasal steroid sprays. These are things like Flonase, Nasonex, Rhinocort, Nasacort. These reduce inflammation in your nasal passages and also help with post-nasal drip and a throat clearing cough that often happens from allergies. Then there are nasal decongestants. So these are things like Afrin. These work to constrict your blood vessels because when you have allergies, your blood vessels are swollen and that's why you're congested. So now let's talk about the best time of day to take these allergy medications so that they are the most effective. Let's start with antihistamines. There are first generation antihistamines and second generation antihistamines. First generation antihistamines like Benadryl can make you drowsy because they cross over into the blood-brain barrier and have significant side effects. They also can prevent you from peeing, and long-term use can lead to Alzheimer's and other forms of dementia. So we're not even going to talk about first generation antihistamines. So second generation antihistamines like Claritin, Allegra, Zyrtec, or Xyzal typically last for 24 hours. And some of them can cause a little bit of drowsiness, so patients prefer to take them in the evenings. You can also take these medications as needed at the first signs of an allergy attack, and they typically kick in within the hour. Oral decongestants like Sudafed should be taken first thing in the morning. They can have significant side effects like increased heart rate and disruption of your sleep. So the last thing you want to do is take it after 12 o'clock in the afternoon because it could impact your ability to sleep. Additionally, you do not want to take oral decongestants for more than a few days at a time because over time they can cause cardiac arrhythmias or an irregular heart rate and can increase your blood pressure. Nasal steroid sprays are best taken at the same time every day. I will typically recommend to my patients, hey, you brush your teeth first thing in the morning and then just take 2 sprays of your nasal spray. And I often will say, just keep it right next to your toothbrush so you remember. The reason why it's important to take it at the same time every day is because these medications build up in your system over time and they really take 5 to 7 days to reach their peak benefit. A lot of times I'll have patients say to me, oh, things like Flonase or Nasonex don't work. And I ask how they're taking them, and they're taking them as needed. These medicines don't work as needed. You really have to have them built up in your system, and I typically recommend to my patients to start them about a week before the start of allergy season so they're built up in your system and prevent an allergic reaction from even starting in the first place. Nasal decongestant sprays like Afrin can be used throughout the day as needed, but remember, you don't want to use these sprays for more than 5 to 7 days. The reason? They're actually so good at constricting the blood vessels and helping you breathe better that when you stop, you get a fancy term called rhinitis medicamentosa. That's just a fancy word of saying rebound congestion, where those blood vessels pop back open and become very, very dilated and cause really bad congestion in your nasal passages. So then you end up in this vicious cycle of being addicted to the Afrin, and oftentimes people need to take oral steroids like prednisone for a long period of time to get off of the Afrin. But if you use it here and there for a couple of days when you're feeling super congested, that's okay. So we just went over when to take allergy medications. Let's talk about how to take allergy medications. I will often find patients coming to me saying, well, I already take an antihistamine, so I shouldn't take a nasal spray. The truth of the matter is you can mix allergy medications. Now, you don't want to mix allergy medications within the same class, so there's no need to take, let's say, a Zyrtec and a Claritin on the same day, although sometimes we will recommend you taking 2 Zyrtec a day. However, taking something like a nasal steroid spray like Flonase in addition to an antihistamine like Zyrtec is perfectly fine because they have different mechanisms of action, meaning they act on different parts of your allergy cells in different parts of the body. Remember, antihistamines work through your bloodstream, whereas nasal steroid sprays and nasal decongestants work locally in your nasal passages. Now, you always want to make sure you follow dosage instructions on the back of the label, and you want to check with your doctor as well. Beware of multi-symptom medications. This is where it becomes dangerous to mix because these multi-symptom medications can often have the same exact ingredients in them. And if you're not sure, check with your doctor. In addition to medication, or as an alternative to medication, I'm going to give you some additional allergy tips that can really help with your symptoms. Number 1, avoid your triggers. What does this mean? You need to understand the timing of your symptoms, what activities you're doing when you're experiencing symptoms, and from there, we can figure out exactly what is triggering your symptoms and how to avoid it. For outdoor allergies, you want to make sure that you keep your indoor environment a sanctuary. So leave your shoes at the door because they can track pollen into the house. If you have pets and they've just gone outside for a walk, you want to make sure that you wipe them down. You want to keep the windows closed and the air conditioning on if possible. You want to have an air filter or an air purifier that is the appropriate size of the room so that if pollen does get tracked into your home, it gets sucked out of the air right away. And you want to make sure you take a shower right after you come inside after being outdoors and rinse your hair off and your body. Throw your clothes in the laundry because that minimizes the amount of pollen that's tracked into your home. Hot tip, if you have itchy allergy eyes, pollen can get stuck in between your eyelashes. You want to take a cotton swab and some baby shampoo and then just gently scrub in between your eyelashes to get rid of the pollen. And that can even work better than antihistamine eye drops. Lastly, I'm a big fan of nasal rinses, so things like a neti pot or sinus rinse, or you can just use a nasal saline spray. This is a medication-free way to flush pollen out of your nasal passages. Because remember, if it's stuck in your nasal passages, it's going to trigger an allergic reaction over and over again. So just like you wash your hands when they're dirty, think about washing out your nasal passages regularly during allergy season. So to recap, you can take non-drowsy antihistamines in the morning and the ones that make you a little bit drowsy in the evenings. And remember, these can be taken on an as-needed basis, not necessarily every day. Take decongestants first thing in the morning and don't use them for more than 5 to 7 days. Make nasal steroid sprays part of your routine first thing in the morning, and remember, they take 5 to 7 days to actually kick in and start working. Follow these guidelines and tips to effectively manage your allergies. Thanks for watching, and don't forget to subscribe for more health tips. All right, on to the next video.